We're learning more about what's called long COVID, where patients report debilitating symptoms lasting weeks or even months. And although more than $1 billion is being spent on research, some patients say that it's still hard to convince doctors their symptoms are real. Consumer Reporters followed one woman's long COVID journey that could help you or anyone you know who suffers from it find relief. For years, 72-year-old Louise Sallant had her asthma and acid reflux disease under control. But that changed when she got COVID in March of 2020.
I could never get a full breath. I thought for sure I was going to die.
Hit by debilitating fatigue, Louise spent weeks in bed. Her inhalers barely worked. COVID aggravated a condition related to her acid reflux so badly she had to have life-saving surgery, but her problems persisted. More than 2.5 years later, Louise is like the estimated tens of millions of people affected by long COVID. And although there's no test for it, the CDC now recognizes it as an emerging condition and has released guidance for doctors to help treat patients.
Tell your doctor about your symptoms like fatigue, brain fog, breathing issues, or stomach troubles. They may also refer you to a specialist. For example, if you have heart palpitations, they may suggest a cardiologist.
Also, look for a long COVID clinic at a hospital or university and seek out support groups. Survivor Corps, Body Politic, and Long COVID Alliance can help connect you with providers and people who are experiencing the same thing.
If your daily activities are substantially limited, you could try applying for disability benefits, which may offer some protections like job leave.
And make sure your doctor knows the diagnostic code for long COVID, U09.9. That way, insurance may be more likely to cover cost. While Louise's insurance covers her new inhaler, her copay is still costly, nearly $400 for a 3-month supply. Her quality of life over the last 17 months has improved. She can now resume normal activity on a given day, but she has to recover in bed all day the next.
I made it through, and I'm improving. I'm grateful to be alive.
Okay, so you want to keep in mind that getting vaccinated and boosted may minimize the risk of long COVID by reducing your chances of getting sick in the first place. Consumer Reports says to make sure that you stay up to date on your shots.